how to achieve a Tinkerbell nose with Botox. And is that even a real thing? I wanted to do this video because many of my patients have been coming in lately saying that they want a Tinkerbell nose or an upturned nasal tip, or nose slimming and to decrease the width of the nose, or to have other enhancements just in the nose alone with just using neuromodulator or Botox without surgery and without filler. After watching this video, you'll understand the indications for Botox and neuromodulators and the things that we can do to improve the cosmesis of our nose without surgery and without using dermal filler. My name is Dr. Stephanie Kappel, and I'm a board-certified, double fellowship-trained cosmetic dermatologist in Newport Beach, California. And the reason I wanted to do this video is many patients have been coming in over the last few weeks saying that they've seen trends on TikTok for nasal slimming and to upturn the tip of the nose, and I feel that there's a little misleading and a little unrealistic expectations when it comes to just neuromodulators alone and improving the nose cosmesis. So this video is just focusing on neuromodulators. And when I say neuromodulators, I mean Botox or Botox equivalent. It can be Jeuveau, Daxxify, Dysport, Xeomin, you name it, any neuromodulator that's going to affect the muscles in our face, and in this case, in our noses, to achieve a certain cosmetic result. Now you have to remember, Botox and neuromodulators affect the synapse-nerve complex. And what that means is it helps relax muscles in the face to have a more pleasing aesthetic look, right? So to help fine lines and wrinkles, to help relax wrinkles, and to help with things like facial slimming when we do it in the masseters, or to define and sharpen the jawline with a Nefertiti lift, or to smooth out a neck if you have neck bands. There's certain muscles that we can target with neuromodulators to change the structure and to change the appearance by acting on muscles. But it's just that, just limited to the muscles. When you look at someone's nose, you have the cartilage, the ala, you have the structural bridge of the nose. These are all structural support systems underneath the skin that are made up of cartilage and bone. And no amount of Botox is going to decrease the width of a cartilaginous structure under the skin. So I feel that it could be a little misleading online when you see these before and afters that may be fabricated by some injectors when you're seeing a decrease in the actual width of a nose. Now, I'm going to go into the mechanism of action on how you can treat the nasalis muscle, which is this muscle on the nasal bridge on either side, which can treat the quote bunny lines, those kind of little lines that we form when we scrunch our noses, especially if people are getting Botox in other areas. Sometimes the nasalis muscle will overcompensate because if it's not Botox and all the other muscles are, it kind of over constricts and can cause these little bunny lines. It also can be used to be injected to help slim down that nasal bridge. But again, it's just going to stop at the muscle. If you have a thicker muscle in the bridge of your nose, which we call the nasalis, it will slim that down, but only to a certain extent, because you can't slim the nose further than where the cartilaginous structures and the bony prominence of the nasal bridge is. That just doesn't make sense. So a common area that we use to treat the nose with Botox is for the bunny lines. And again, it's to smooth out those little bunny line wrinkles, and it's to help decrease to a certain extent the width of the nose. So the depressor septi nasi muscle is this muscle right here, and that is the muscle responsible for what doctors call a plunging tip. When you smile and in your profile, the nasal tip drops and moves down because of contraction of that muscle, and that's just an anatomical variant. So if you've noticed in pictures or videos of yourselves when you smile and your nasal tip plunges down, plunging tip, doing a small amount, and I mean like 2 to 5 units of Botox in this area right here can help with upturning the nasal tip when you're smiling and keep it from plunging down. Now, other people who don't have a plunging tip can also have Botox in the same area to kind of upturn the tip of the nose. Now, as we gain wisdom and have birthdays and get older, we do have what we call ptosis of the nasal tip. The nasal tip starts to drop, just like the length between your upper lip and your nose starts to lengthen. It has to do with the bony changes that happen as we age and get older and live life and gain wisdom and have birthdays. And what happens is you can start to have ptosis, or the nasal tip starts to drop. So for those of you who have that, doing a little bit of Botox in that area can kind of upturn the nose, and that is what's called the Tinkerbell nose. Again, I feel like it's really important to manage expectations because people sometimes think that with a small amount of Botox, they're gonna have like a totally different structure of their nose, especially if they have like a bulbous tip. It's not going to change the width of the tip or the bulbous tip, but what it will do is it will help decrease that plunging tip and will help keep the nose upturned, which looks really cute in a profile. So we've talked about the bunny lines, we've talked about the nasal bridge widening, we've talked about a nasal tip ptosis, we've talked about plunging tip, we've talked about many indications for Botox, but the last and another one that's very commonly asked about in my office is to widen the ala. So these little nostrils right here are called the nasal ala. And when you do a small amount of Botox, again, I'm talking 1 to 2 units. I'm a very conservative injector, but quality versus quantity is very important, especially when injecting a very pristine and delicate structure of the face like the nose. Just a small amount is used right here to kind of help widening of the nasal ala. This is great also for people who animate, and when they're talking, their nostrils flare a little bit, and that happens to some of us. So doing a little bit of Botox right there will help the nose not flare when you're talking or when you're getting excited and you're, talking and laughing with your friends and family. It kind of helps keep that nose not so wide, and it also will help to a certain extent slim the nose a little bit. But again, the structural support of the cartilage underneath the skin is going to limit how much it can shrink or slim the nose. So I think it's really important to manage expectations and to know that without surgery or even dermal filler, which I actually don't do in the nose at all, and I'm an expert injector just because dermal filler in the nose can be very risky without an ultrasound or an astute provider, because there is a high risk of complications in that area, and even I don't do it. So if you're going to go to an injector for filler in the nose, I always recommend see a provider who is well versed with that procedure and who has an ultrasound to make sure that you're in the best hands, because it could be a very risky procedure. But we can do a lot with Botox, but again, it's managing expectations, and sometimes subtle is more, less is more, and those little subtleties can make us look and feel our best. Doing a little bit of Botox in the nasalis so that the bunny lines are kind of smoothed, and also it kind of helps minimize the fine lines and wrinkles right under the medial eye, which we can't really go. It's a no-fly zone for injecting Botox right in that area. You can kind of cheat and get right next to it by injecting the nasalis muscle right here, which will kind of help slim the bridge of nose. Again, in the ala to kind of help with the flaring, in the bottom of the columella, which is what we call this area right here, to help with the plunging tip, and to upturn the nasal tip for a cuter, more pixie-like nose. So I hope this manages your expectations if you're looking into getting a neuromodulator or Botox equivalent, or Botox for the nose for cosmetic indications. But again, it's always important to manage expectations and to know that without surgery or without dermal filler, the limitations are very limited with what we can do for the nose. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.